Welcome back. Now, let's begin with the gastrointestinal physiology. First, let's start from the basics. We all know our GIT is like a tube. Okay, starting from the mouth till to the anus, it's like a tube. Now, this gastrointestinal tract, okay, this tube, it is made up of how many layers? See, from outside to inside or from inside to outside, there are 4 layers. Okay, there are 4 layers in our GIT. What are these 4 layers? The innermost layer of the GIT is called as the mucosa. So, there will be mucosa, submucosa, muscularis, and the outermost region is called as the serosa. So, basically how many layers are there? 4 layers are there: mucosa, submucosa, muscularis, serosa. These are the 4 layers. And in this diagram, you can see those 4 layers. So, this innermost layer which I am highlighting here, this is called as a mucosa. This whole structure is the mucosa. Okay. Now, in the mucosa itself, you can identify, okay, in the mucosa itself, you can see there are sublayers present. For example, in the mucosa, there is an epithelial layer, lamina propria and muscularis mucosae. 3 sublayers are present. You can see here, this is the epithelial layer of the mucosa, and there is this whitish color layer with the glands inside it. This is called as a lamina propria, and here there is muscularis mucosae. Okay, muscularis mucosae. So, there are some muscles also. So, here we have seen there are 3 layers in the mucosa. Now, back to the mucosa. Guys, look here, this whitish color layer which I am highlighting, this is called as a submucosa. Okay, this area which I am highlighting is called as a submucosa, and all this area is also submucosa. Okay, in the cut section I am showing you the submucosa. Now, you can appreciate within the submucosa, okay, within the submucosa, there is this nerve plexus present. Okay, this yellow color nerves are present, right? So, what is the name of this nerve plexus called as? See, this nerve plexus, it is called as the Meissner's plexus. Okay, Meissner's plexus or submucosal plexus. Now, the question is, what is the importance of this Meissner's plexus or the submucosal plexus? Yeah, there are millions and millions of neurons. See, these submucosal plexus helps in the GIT secretions, glandular secretions, mucus secretion. Okay, so these are the nerves which are mainly helping in the secretions in the GIT. Okay, now back to the submucosa, there is this muscularis layer. Here you can see this muscle layer. Now, even within this muscle layer, see, first of all, this is called as a muscularis. Now, even within this muscularis layer, there is this nerve plexus present. These nerve plexus are present. Now, what is the name of this nerve plexus called as? Now, here, this nerve plexus which is present in the myenteric layer or this muscle layer is called as a myenteric plexus. Okay, myenteric plexus also called as a Auerbach plexus. So, now tell me, how many types of nerve plexus that we have studied so far? We have studied 2 types of nerve plexus. What are they? Meissner's plexus for the secretions and myenteric plexus. Just now I have taught you, right? This myenteric plexus, this is for the contractions of the muscles in the GIT. So, for the contractions, there is a myenteric plexus, and for the secretions, there is Meissner's plexus. Meissner's plexus is a submucosal plexus. It is present in the submucosa, and this Auerbach plexus, it is present in the muscularis layer. Done? Now, the final layer here is the serosa. This whitish color layer which I am showing you here, this is the serosa. Okay. Now, what are the important points that you should know for your exam? First of all, in mucosa, see, one important MCQ is there. In mucosa, there is this muscle layer present or not? Yes, you can see this muscle layer. This is called as a muscularis mucosae. Now, this muscularis mucosae, okay, this muscularis mucosae. What is the function of this muscularis mucosae? These muscles, are they help in contraction of the GIT? No. So, it's a muscle layer, okay, which is not involved in any contractions. Usually students will think muscles are helping in the peristalsis, segmentation. No, these are not those muscles. Okay, do not cause peristalsis. Okay. So, then what are those muscles which are involved in the peristalsis? These muscles, okay, which I am highlighting here. The muscularis propria, this is the muscularis propria. These muscles are helping in the peristalsis, not the muscularis mucosae. Next important point that you should know, guys, here, see, what is the problem with this celiac disease? Guys, in celiac disease, there is a problem in which layer of the GIT? It's a mucosal disorder. Okay, celiac disease, which is also called as the gluten sensitive enteropathy. The problem is with which layer? The problem is with the mucosal layer. There will be mucosal atrophy. Okay, there is mucosal atrophy, there is loss of villi, there will be crypt abscess, lot of things will be happening. Okay. So, what I am trying to say, guys, this simple carbohydrate called as a D-xylose. For the absorption of D-xylose, you need to have the intact mucosa. Okay, no need of digestion, no need of any enzymes, nothing. In a person, in a healthy individual, if you give this a D-xylose, okay, if he takes this D-xylose, if he is having a proper normal mucosa, then D-xylose will be absorbed, no problem. But in a patient who is having the celiac disease, where the problem is with the mucosal layer, so do you think he can absorb the D-xylose? No, because the mucosa is gone, there is loss of mucosal villi. So, without the proper mucosa, the D-xylose test or the D-xylose absorption will be affected, there is malabsorption. So, what I am trying to say, the D-xylose test will be abnormal. In which disease? Celiac disease, because it is a mucosal disorder. So, indicating which malabsorption? Carbohydrate malabsorption. Okay, done. So, with this, the important points about the mucosa are completed. Next, submucosa, the first important point, it is the strongest layer of the GIT. Strongest layer of GIT. Next, in submucosa, there is a nerve plexus present. What is the name of that? Right, nerve plexus. It is the Meissner's plexus. What is the important point about the Meissner's plexus? Meissner's plexus helps in GIT secretions. Okay, GIT secretions. Then what about the muscularis layer? See, muscularis layer also contains a nerve plexus. What is the name of it? Enteric plexus. Okay, so this Enteric plexus, also called as the Arbuck plexus, mainly helps in GIT contractions. Okay, next step about the serosal layer. Guys, serosa, one important point is, it is absent in which part of the GIT? It is absent in esophagus. It is absent in esophagus. Now, let us see what else you should know for your exam. Guys, have you ever heard about this enteric nervous system? Means even within our gut, there is a nervous system that is called as the enteric nervous system, which is nothing but the Meissner's plexus and Enteric plexus, which is nothing but the Meissner's plexus and Enteric plexus, guys. Now, my question to you, how this Meissner's plexus and Enteric plexus actually came into the GIT? See, neurons were supposed to be present in the central nervous system or the peripheral nervous system, but how come the neurons came into the GIT? Okay, there are almost 100 million neurons, guys. This Meissner's plexus and Enteric plexus contributes to almost 100 million neurons. Lots and lots of neurons are there. So, these Meissner's and Enteric plexus developed due to a process called as neural crest cell migration. Okay, because of this process called as a neural crest cell migration, there are these neural crest cells which goes to different parts of the body and they form these nerve cells. So, these neural crest cells during development, they came to the GIT and they form this Meissner's plexus and Enteric plexus. Okay, done. Next, let us see some clinical importance, how we have to integrate the Meissner's plexus and Enteric plexus and the neural crest cell migration topic with a disease. First, the name of the disease that we are going to discuss is called as the Hirschsprung disease. Okay, what is the problem in this Hirschsprung disease? Let me tell you. Guys, try to understand. Here I am showing you intestine. Which intestine? Large intestine. Let us say ascending colon, there will be ascending colon, transverse colon, descending colon and rectosigmoid colon. Okay, last part. Now, in this last part of the GIT, say I am taking a segment in this area, let us say. Okay, the last part. See, in this part of the GIT, there is absence of both Meissner's plexus and Enteric plexus. There is both Meissner's plexus that is absent as well as the Enteric plexus absent. So, right, point number 1, absence of both Meissner's and Enteric plexus. Meissner's plexus and Enteric plexus both are absent, both are gone. Now, whenever the Meissner's plexus and Enteric plexus, whenever both are gone, this particular segment, especially the last part, that is the rectosigmoid, This segment is called as aganglionic segment. What is the name of the segment? There is a ganglionic segment. Now tell me, in the aganglionic segment there is absence of both mesos plexus and migrating plexus. And what is the most common site of this aganglionic segment? Rectosigmoid. Rectosigmoid area. Now tell me, what will happen? So, in this particular part of the JAT, what do you think? In this particular part of the JAT, there is no peristalsis, there is a functional obstruction. So, because of no migrating plexus, do you think that part of the JAT is going to contract? No, it's acting like a functional obstruction. Functional wise, it's not contracting, so it's acting as an obstruction. So, there is functional obstruction. Because of this, there is functional obstruction. Now you will have a doubt. First of all, why all this problem is happening? Why there are no migrating plexus and mesos plexus in this area? Because it's a defect. The entire problem lies here. Defect in neural crest cell migration. Neural crest cell. There is a defect in neural crest cell migration process. So, the neural crest cells didn't came to this area. Okay, the neural crest cells didn't come to this area, so there is no mesos plexus and no migrating plexus. So, there is a functional obstruction. Now, you tell me, which people will develop this? Okay, this Hirschsprung disease. Who will develop this? Associated with, okay, associated with Down syndrome. Associated with the Down syndrome, which is trisomy 21. Okay, there is extra 21 chromosome. Okay, so who will develop this Hirschsprung disease in association with the Down syndrome? Those people who are having Down syndrome, you all know they will develop Alzheimer's at the age of 40 in the same way. Those people who are having this Down syndrome is at a risk of developing this Hirschsprung disease. Okay, where there is an aganglionic segment causing functional obstruction. Now, I am asking you, you tell me, there is a baby who is suffering with this Hirschsprung disease. So, there is this functional obstruction, right? So, do you think this baby can pass the feces? No, the baby cannot pass the feces because there is an obstruction. Usually, babies when they are delivered, they are going to pass the first feces called as a meconium. So, here there is obstruction, so there is failure to pass the meconium. So, clinical features include failure to pass meconium. Okay, the babies are not passing the meconium because of this obstruction. So, you tell me, when the baby is unable to pass the feces, okay, the feces is coming till here and the baby is unable to pass. So, what will happen to the proximal segment? Okay, so this area which is absolutely healthy, what do you think will happen? So, this area, as there is an obstruction here, this area is going to become dilated or distended, you can say. Okay, as there is an obstruction, we all know, as there is an obstruction, proximal to the obstruction, what will happen? There is going to be hypertrophy. Okay, first of all, there is a distension, upon which there is also hypertrophy, because these muscles now they have to work hard in order to push the feces. Okay, so this area is going to become big. So, that's why we are going to say it as a megacolon. So, what happened to the size of the colon? The size of the colon increased. So, there is a megacolon. So, that's why this Hirschsprung disease is also called as, this disease is also called as aganglionic. Aganglionic, or you can say congenital megacolon. And who is going to develop this? So, it's a Down's babies. Okay, it's a patients who are suffering with the Down syndrome going to develop this. Guys, one more important thing which I want you to know. Whenever a patient is suffering with a Down syndrome, the Down syndrome persons can have multiple organ involvement, that's fine. Down's patients can have which GAT problems? Okay, I am talking about the GAT, right? The patient who is suffering with the Down syndrome can have two GAT related problems. What are the two GAT related problems? One is, you know, the Hirschsprung disease. These patients can also develop the duodenal atresia. So, a patient who is suffering with the Down syndrome can manifest two GAT related problem. One is Hirschsprung disease. The second one is the duodenal atresia. So, whenever there is a duodenal atresia, you all know the patient is going to have vomitings. Okay. So, why I am showing you here? It's because a very important MCQ. The patient who are having this duodenal atresia, they are going to show up with double bubble sign. Okay, double bubble sign. One is the stomach. The first bubble is the stomach with the gas. and duodenum is also having a gas. So duodenum is not continuing because there is an atresia, right? So a patient who is suffering with a Down syndrome can have two GIT related problems. One is the Hirschsprung disease and other is duodenal atresia. So duodenal atresia on the chest X-ray abdomen, what you can see? You can see double bubble sign. Where do you see triple bubble sign? Recently asked MCQ, triple bubble sign is seen with the jejunal atresia. Jejunal atresia present with the triple bubble sign, duodenal atresia present with the double bubble sign. Okay, fine. Next, how you are going to treat this condition? See, as there is an obstruction here, what kind of drug you have to give? You have to give drugs which can cause the contraction so that the patient will have the normal defecation. So, you have to give drugs which can increase the contraction. So, the drug of choice in this condition, okay, the drug of choice, the treatment of Hirschsprung disease is bethanechol. Okay, bethanechol. We all know Beth stimulates bowel and bladder. Bethanechol is a drug. Okay, it stimulates bowel and bladder. It causes the contractions of the bowel so that the patient can have the normal feces. So with this, what we have completed? We have completed the basics. What are the different layers of the GIT? Okay, what is the Meissner's plexus, Meinrich plexus, and what happens if the Meissner's plexus and Meinrich plexus is not developed? That's the Hirschsprung disease. Hope the video is helpful. In the next video, we will be discussing about the GIT secretions. Thank you.